Turn wound documentation into clean revenue, with clinical notes, coding, and coverage connected in one workflow. Denials start in the chart, not the claim. Most wound care revenue leakage traces back to weak documentation upstream. Free text notes miss required elements, coding happens days later, and coverage gets checked after treatment, if at all. The cost is preventable denials, delayed reimbursement, and compliance exposure on high-scrutiny wound claims. Fewer denials happen when documentation, coding, and coverage are built together. Cleaner records at capture mean defensible claims that clear the first time. OnePass takes a wound visit all the way to a defensible claim, documenting, coding, and verifying coverage inside a single visit. Point-and-capture imaging measures the wound, ambient scribing structures the note, and codes are generated at the source from what actually happened. Then, coverage is verified against prior auth, frequency limits, and LCD policy, and the claim is cross-checked ready before submission. 4 levers land directly on your revenue cycle. Cleaner claims come from complete defensible notes produced at the point of care, with defensible ICD-10 and CPT coding drawn straight from the encounter. Coverage upfront prevents denials before treatment, and less rework returns hours per clinician each week to your staff. Coverage gets verified before the clinician treats, so your billing rules reach the exam room and nothing surprises billing later. The clinician sees CPT 97597 covered, prior auth on file, frequency limits, and LCD criteria met while the patient is still present. Built for reimbursement, not just notes, the comparison closes the revenue gaps typical wound documentation leaves open. WoundScribe carries structured wound data, coding at source, coverage verification, prior auth and LCD checks, and a denial readiness check that generic EMRs and standalone scribes don't. One standard of documentation applies everywhere you deliver care, so continuity across settings means every clinician starts fully informed. In clinic, hospital, home health, long-term care, podiatry, and mobile providers all chart to the same structure your billing team expects. The revenue cycle case lands in 4 numbers your team already reports upward. Denials go down as defensible documentation clears on first pass, and clinicians get hours back each week on charting. Coverage is verified upfront before treatment begins, and every record stays HIPAA compliant and audit-ready by design. Fix the note, and the revenue cycle fixes itself. When the chart is right the first time, the claim is too. The clinical and technical leadership behind the platform brings wound care expertise and AI engineering built for health systems. Shayan Mashadian drives the AI native platform as founder and CEO, alongside President Dr. Desmond Bell, bringing deep wound care clinical grounding. Chief Medical Officer Lucian Ferru guides clinical and coding accuracy, while CTO Masood Hashemi leads enterprise-grade AI engineering. The next step is to model your denials and days in AR. Book a working session, and we'll map WoundScribe to your wound care revenue cycle.